One of the most challenging hurdles for veterans is navigating the Veterans Affairs disability compensation process and the healthcare system. Inaccurate decisions, long waits for decisions, and large claims backlogs are all issues that are keeping vets from getting the claims payments they need after disability linked to their service. The Texas Veterans Commission helps make the process a little bit easier, and it's at no cost.
Yeah, and to talk about that, we have Sal Castillo, Texas Veterans Commission Claims Director and Air Force veteran. And we also have Mr. Gary Lee, Healthcare Advocacy Director and Marine Corps veteran, joining us this afternoon to really give us insight on how your agency is helping. Gentlemen, thank you so much for being here with us this afternoon.
Thanks for having us.
Thank you for having us.
So I'll start with you. Can you just paint the picture for us about the biggest challenges, maybe the top 2 or 3 challenges that veterans are facing really in accessing their benefits, because we know many of them are facing this issue?
Correct. Just having the right information, where to go, how to go through the process. As you mentioned, the VA can be very complex on navigating. So a lot of the challenges that we see is just not knowing where to go or how to seek these benefits. But luckily, the Texas Veterans Commission, we're here to help them out and guide them in the right place so they can go ahead and get their benefits that they've earned.
So Gary, a lot of red tape involved, with any government agency really. So when you want to file a claim, what are the first essential steps that one should take in order to do that?
Well, one of the first essential steps, and I can add this to what Sal was saying, understanding how the process works. There's sometimes you can just go get the form and try to fill that out, but salespeople do a wonderful job explaining to the veterans, okay, here's how you can enhance your opportunities, your possibilities of getting approved, that type of thing. His people are experts at doing that.
And what should a veteran do if they're being denied their VA disability claims? Because we know that they might try for years. We've seen them try for years and they get denial after denial. What do they do?
So essentially, when they schedule an appointment, we have staff throughout the state embedded with the VA and some in the counties, and we work with all levels of government. They can come to us, and we are there, and we have the knowledge and experience, so we can guide them. We have to find out the reasons as to why you got denied, and then try to get the evidence that is needed to overturn that decision.
So are there like common mistakes that people make that lead to them getting a claim denied?
Well, I'll go back to the first point I made. It's just the information. Sometimes it can be very confusing, but we luckily have our claim benefit advisors that can look at it and tell you exactly what piece of evidence you need to present to the VA. A lot of it is just you just don't know. A lot of the narrative is confusing, and so we're there to help.
Okay, something interesting that you all said, persistent pays in pursuing claims. So how is your office, you were able to get I believe it was $30,000 in retroactive payments to a veteran. How have you all been able to really help that happen and help the veterans get benefits that you said that they deserve and they need?
Correct. So going back when we analyze their cases, we find out what went wrong. Right, and then we try to correct it by providing the evidence that's needed for the VA. Once that is established, if it was years that they were waiting for that to come back and we find an error that the VA did within their regulations, that individual can actually get that retro payment. Now you mentioned this $30,000, there's been some cases that $500,000 or $800,000, and it doesn't only concern the veterans, also spouses or widows and their benefits, their children as well.
What's the best way to reach your organization if somebody is out there and needs that help?
Right.
Well, we have, as far as the Healthcare Advocacy Department, or HCAD, we was put together specifically to assist veterans with dealing with the Veterans Health Administration, that medical side of the VA. We understand there are special stressors in addition to the initial confusion of dealing with the VA. We understand when you're dealing with health concerns for yourself or your loved ones, that's an extra level of stress. We have 24 wonderful individuals throughout the state that assist veterans with that, become that liaison between them and the Veterans Administration. You can go to our website. I think you already have that. That's www.tvc.texas.gov. And it will give you information. You can find tabs for the Claims Department, for the Healthcare Advocacy Department, employment, education. We have various factors, various departments and programs that are designed specifically to help veterans deal with the VA systems, whether it's healthcare, claims, or other factors, employment, education, those things. But we have wonderful people that help veterans deal with that stress. We have wonderful support. We work together to assist veterans within the agency, and also the support we get from our agency leadership and the legislature and the partners with the VA. There are a lot of people involved. If a veteran just reaches out to us and let us know what they have, what they're trying to get, we'll try to do that for them and help them manage their expectations and understand the processes.
And I think that it's so, and go ahead, Sal, yeah.
Yes, and we've recognized that some of the veterans are still very much involved in, working, right? So we extended our hours, which is something that is unique to our state, that we work all the way to 8 o'clock so they can get off work and access our assistance through that. Yeah.
Which is important. So we'll put all of that information on our website, kxan.com. And thank you so much again for being here. And I think that it is so important to emphasize the fact that these services are free.
Correct.
Yes, yes.
Thank you.
No
Thank you
cost
for
to the
joining
veteran.
us. Yeah, thank you
All
for
right,
joining
thank
us
you for
this
having us.
afternoon.